Now, in this part of the program, we want to look at a number of Montana's major industries. And specifically, we're going to start by looking at the non-resident travel industry. And I'd like to invite Norma Nickerson. She is director of the Institute for Travel and Tourism Research at the School of Forestry and Conservation, University of Montana. Norma.
Good morning, everyone. Are you seated? You have your caffeine? You're ready to go again? That's good, because I don't have that good of news either for the rest of you, and this is really kind of depressing to be up here in a way, but the outlook hopefully will be a little bit better. We do a survey every year of the Montana businesses, and so the first slide I'm going to show you is, I could probably just show this slide and walk off the stage here because it kind of sums it up for everything that we're talking about in the travel and recreation business. So what are they saying? There's the tourism businesses around the state when we asked them in November this year. Well, they seem to be looking for less, they are the visitors, seem to be looking for less expensive ways to enjoy themselves. They shop around more, don't plan as far ahead for a vacation, many last-minute bookings. Retail store sales are down, and people didn't sign up for as many activities. More camping, visiting national parks, shorter stays. There is a fear factor out there that makes people want to hold off a vacation until our nation or world economy is more stable. Somehow we need to portray the message that life is about living and creating memories despite what Wall Street says. So I kind of like that last one because it's true. We need to be looking beyond that a little bit, but it definitely was felt in the travel industry. And let's look at it a little bit. If you look at the United States and some of the segments that fall within the travel industry, you'll see a lot of negatives up there. The lodging industry was down 6.2%. Domestic air travel was down 2%. Attractions are predicting that they will be down 4 to 6% in 2009. RV sales down 54%. Boat sales down 30 to 35%. Alpine skiing down 5%. All of these in 2009. I go to the other side, and there's a few pluses out there. National parks were actually up 4% throughout the United States in 2009. The restaurant industry, and some people might look at this and go, well, that's really odd that people who are not spending as much are going out to eat, but maybe that's the only thing we're doing is going out to eat because we got to do something, right? So the restaurant industry was up 2.5%. Private campground visitation, they're saying, is up at least 1%. And snowmobile registrations last year were up 1%. I'm not quite sure where that one falls in because that's kind of a gas guzzler part of the industry, but they were up. So when you're thinking of all those segments at the national level, what was happening in Montana? Well, we're looking first at visitation, the number of people who are coming to the state. And in 2008, we had a huge drop. If you remember 2008, we had a huge increase in gas prices. So it obviously affected the number of people who were coming here. But this past year, we were basically flat, meaning that the same number of people who came in 2008 also came in 2009, which was better than the U.S., which experienced a 3.8% decrease in travel. Our 0.1% decline looks pretty good. But as I mentioned in the first slide, while we may not have had fewer visitors coming here, we actually are seeing that spending by these visitors is going down. So I mentioned the gas prices in 2008, not as much of an issue in 2009, but then the economy hit. So it is a conscious consumption. I think Pat mentioned earlier that consumer spending is down 30% in 2009. Domestic leisure travel spending down 10.3%. Domestic business travel spending down 13.6%, and international travel spending down 16% in 2009 for the United States. Our Montana tourism business owners have indicated through our survey, 55% of them said that retail was down. 47% said that dining out was down, which kind of goes against what was being said in terms of the restaurant business, but maybe those who aren't vacationing still go out to eat. Who knows? 60% said visitors were looking for less expensive activities. 39% said they saw more staycations, the people staying closer to home and doing their travels closer to home. 33% of the businesses saw their length of stay decreasing. and then 53% observed more last-minute bookings. And I think what we're seeing with travel is people still want to travel, but they are looking for the good bargains, and they're waiting to feel a little bit better about what's going on out there, so they're doing it at the last minute. They are still traveling, like I mentioned. But how is that converting to spending in Montana? Now, this graph that you have up here is third quarter. This year we started collecting non-resident visitation data, which includes all our expenditures and what they're doing and all that kind of stuff that we find out about our travelers. The data that we collected for third quarter this year, or 2009, this represents about 4,300, a little over 4,300 non-resident surveys that were completed. And it is down. In fact, it's down 27% from 2008 in their spending patterns while they are here in Montana, and has brought it below the 2002 spending levels that we saw. And these are in actual dollars, so if we actually inflated it, I wouldn't want to show you that graph. All spending segments are down except the camping one. What a surprise. You've been reading in the paper, if you've been reading the paper and hearing it on the news, that the state parks were up. I just mentioned the national parks were up. And what do you do when you go to parks? A lot of people are camping. And with the gas prices not as bad as they were in 2008, we did see more RV travel. And when you're traveling in an RV, obviously you're going to be camping. But expenditures of gasoline was actually down by our non-resident visitors, which goes to show you that when they are coming here, they're not traveling around as much while they're here. They're kind of staying in one spot and maybe doing smaller day trips from that spot that they chose to be in. Some of the other segments that we're looking at in Montana, rooms sold. And I think you've probably been hearing a little bit about this, but Montana was down about 4% for the year in rooms sold. Better than the Mountain States, which was 8% down. Now, the Mountain States does include Las Vegas, or Nevada, I should say, but as we know, there wasn't much traffic going into Las Vegas this year, and they've been hit really bad, so that kind of brings that one down quite a bit. But at the national level, it was down 6% of rooms sold. Rooms sold also is showing in Montana and elsewhere, while the numbers are down, so is ADR, which is average daily rate that is being charged. And if you look at taxes that are generated, there is a bed tax out there. And again, that's hitting the state of Montana because 3% of the bed tax goes directly into the general fund, which is not getting as much just from the lack of people staying overnight in hotels. And then the hotels have dropped their rates because they're trying to get you to stay there. Another segment, air traffic. This has always been an interesting one because over the years we've been pretty good. We've been increasing in our deboardings in Montana airports around the state. But this year we were down 5.4%. At the nation they were down 2%, like I mentioned earlier. So we didn't do quite as well. Part of that goes to capacity decreases in the airlines that are actually coming into Montana. They're bringing in their smaller airlines, and that shows up this year for sure. At the nationwide level, for example, United Airlines capacity was reduced 15.2% in 2009. Alaska Airlines went their capacity down 9.7%, almost 10%. Delta, Northwest Airline now, together down 8%, and Continental was down 5% in their capacity. All of those service some places in Montana, which brings down our traffic, or number of deboardings that we could possibly have in this state. Looking at it by city, it's kind of interesting because there were two cities that actually did better. That was Great Falls and Helena. But if you look at the volume, and this graph kind of shows you that, you can see that Billings, followed by Bozeman, followed by Missoula, are the three highest traffic airports that we have in the state. If you put Great Falls and Helena together on top of each other, they don't even add up what Missoula gets. And so when they go up, it doesn't put a big bang in the whole thing of what's going on in Montana and air traffic. But Billings was down 8%, Bozeman was down 3%, Missoula was down 3%. Kalispell Glacier was down 15%, but if you're aware of what was going on up there, the runway was shut down for most of August because they were paving it, redoing it, and they were only open 4 days each week or 3 days each week for the month of August, so of course they're going to be down. But overall, it wasn't a good scenario in the airlines that we were down quite a bit. Ski visits. Well, once again, we were down 5.9, almost 6%. At the national level, it was down 5%. So we kind of went along with what was going on there. What they're saying nationally last year is because of the economy, the bigger resorts were the ones that weren't finding the people coming. Those are usually the people who have a higher income, and as Pat said earlier, those with a higher income were probably hit a little bit more than everybody else, and so they weren't going on their big ski packages that they normally do. And that sort of shows up in our resorts. Big Sky was down about 8%, and Whitefish Mountain Resort was down about 5% this past year. And this year, who knows, because we're not getting the snow that we usually would like to get. So I think that number's going to be down again for this year. Here's our up one, our only one that I can show that's really up. Yellowstone, 7.4% increase. In fact, that is their all-time high. I said that a couple years ago too, but now I'm saying it again. So something's going on. People are enjoying our national parks, and Glacier was also up 12.2%. That is not an all-time high, but it's getting close. We are seeing that Yellowstone at 3.2 million visitors is not just all non-residents from all over the country and the world. It's a lot of us that are going to those. So it's a lot of regional visitation going to both Glacier and Yellowstone, but it's also the nationwide visitation that's going there. And what does it mean? It does mean that there is more camping going on. They are going, but they're not spending their money. I'm going to say that I don't know how many different times here today, but that's what we have been seeing through our data. So what are our business owners saying about what is going to happen this next year? I call this the optimism scale because it actually went up this year. So there you go. There's another thing. The business owners are feeling, well, 47% of the business owners feel that their visitation, the number of people that are going to come and go to their resort, go to their hotel, is going to go up in 2010 over 2009, which means that that's good. There might be more visitation. The one thing we have to work on, and I think Pat mentioned it earlier and Paul kind of mentioned it, it's that spending, that conscious consumption of our consumers. At the national outlooks that I go to and hear what's going on nationwide, you know, they're kind of lamenting the fact that people are starting to save their money more. Well, when we're talking discretionary spending, which is what travel and recreation is all about, you don't like to hear that people are saving their money more because that's what's going in that pot. You know, the other side of me says, you know, saving is not a bad thing and people should be doing that. So maybe I go against what some of the national people are saying in terms of get out there and spend your money. Saving is not that bad, and that's what's happening. People are saving, but they're still going on vacation. Somehow, if they're getting some good deals in their motels, their airlines, and that sort of thing, then they might start spending in the retail sector and some of the other areas while they're out there, eating out at a little bit fancier restaurants, that sort of thing. So what are our travel projections for 2010? It's interesting because at the U.S. level, they are predicting almost a 2%, a 1.9% increase in leisure person trips in the United States. They're expecting a 2.5% increase in business person trips around the United States, and inbound international 2.8% increase, which includes a 1.2% increase from overseas visitation. And one thing that we find interesting is while we don't get a whole lot of overseas visitors to Montana, the ones that we do get here do spend a lot of money. They spend more than the Canadian visitors and they spend more than the domestic visitors. So if there's some way that we can encourage those international visitors to get here, they could change that swing of spending pattern a little bit. So what are we expecting for this next year? This is visitation. We do think we can go up again, or go up in 2010, about 2%. It's not a quick growth, but you know what? In Montana, visitation trends never go up really fast. So a 2% growth would be excellent if that were to happen. Once again, 2% growth does not mean the money is being dropped here. And at some point, that's going to change. I don't know if it's going to be in 2010, but we do believe it's going to happen. Once everybody goes on vacation, I've always said this in the past, when you go, don't you shop? I mean, people buy things, whether it's a souvenir or whatever. And what they were doing this year was window shopping. They weren't going in and spending. We think that's going to change, but it might be another year beyond that. So I am going to open it up for any questions that you might have about the travel industry, and hopefully I can answer them for you.
Questions for Norma?
Are you?
In the past, travel has seen some correlation between the travel for unemployment layoffs and increase in travel. Although it may seem counterintuitive, people that are laid off traveling. And I wonder if that pattern is being reflected in this last recession. My second question is, I'm interested in seeing the increase in park visitation, and I'm wondering if the Bureau tracks the effect of media, specifically this exceptional video by Ken Burns. Right. Seems to have caught on and spurred a lot of interest in parks, which may benefit us in Montana. Thank you.
Thanks. So I'll answer that question first. The film that Ken Burns did, absolutely. Yellowstone, when you talk to the people in Yellowstone, they say people are asking them about it. They're saying, well, I saw that film and I want to come here. Films do that. They can bring people in. It perks up that interest. And the good thing about that is it can last for a long time. And I believe they're going to be replaying that again in February or something like that. I'm not quite sure, but it's going to be coming up again. So that's a good thing. In terms of when people are unemployed, are they traveling more? This time, and we've seen this throughout, this time it's a little bit different because it is a global economic recession. And people, there's not too many pockets out there that haven't been hit by it. And so people have been a little bit more stingy, and maybe obviously they're spending, but in terms of traveling far, they might travel, but they're not going as far, and they're not going to spend the money. So they're traveling, but not as much. And then, like you said, it's kind of counterintuitive. If I don't have a job, I also pretty soon don't have very much money. And that if that continues, then we're going to see the travel decline.
Other questions for Norma?
Do you have any other information other than just snowmobile registration as to actual snowmobile use, number one? And number two, do you have any information on ATV use and expansion?
Okay, question was not just registration of snowmobiles, but what's going on in snowmobile use and ATV use. And I don't have exact numbers with me, but they're going up. ATV use is going up and snowmobile use is going up. There's all sorts of reasons that people can come up with, but the one that seems to gel the most is as we all get older and our knees don't work very well and that kind of stuff, but we still want to see some pretty areas, I think people are starting to do those sorts of activities. Good or bad, that's a good question. I'm not quite sure I heard something about the decline in the dollar.
You had mentioned earlier the importance of international tourism because they spend more money. Yeah. My question is, there's been a significant decline in the value of the dollar, so it's now cheaper for foreigners to travel here. Do you expect to have that to have much impact in Montana or in the U.S. more generally?
Anytime our dollar is less than the European and the Asian dollar, they do come here a lot more. So yes, it should have an impact. What brings them to Montana is always Yellowstone National Park. That's why we claim Yellowstone. Wyoming doesn't like it, but we claim it. And as you know, most of the infrastructure that's right outside the parks where people can stay is in Montana. So yes, they do and they will come. Whether or not they spread out throughout the rest of Montana is always a hard thing to know because we don't know that very well. But they will be coming, and at the national level, though, they're not predicting a huge increase in international visitation.
One more question.
Just one question about travel. The cost of flying in and out of Missoula versus people going to Spokane. What would that do if they were comparable rates?
So the question was the cost of travel into Missoula as opposed to Spokane, coming in and out of Missoula versus Spokane. If we could bring the cost down, what do you guys think? Yeah, we all know it's very expensive to get in here. So people, non-residents who are flying here, we do get about 10% of all non-resident travel flies into Montana. 30% of non-resident travel actually flies part of their trip, and then they rent a car and come into Montana. So if we could change that around, we would see more people coming directly here if capacity was there. And right now, that isn't the case. So, yeah. All right, thank you very much.
Thank you very much. Now we want to focus on another key industry in the Montana economy, healthcare. And I would like to introduce Greg Davis, the Bureau's Director of Healthcare Industry Research, and he will look directly at access to healthcare here in Montana and whether current reform efforts really address these issues. Greg?
Okay, well, thank you. I have good news in my presentation, so we'll switch gears there a little bit. You might ask, what do healthcare disparities have anything to do with recessions or recoveries? And I'd argue practically everything. A healthier population is a more productive population, and understanding the disparities amongst us is perhaps important. And I'll talk a little bit about what was healthcare reform. I'm not sure where it's going now. Women do face particular challenges when it comes to health care. We know for a fact that they do spend more on health care, in fact, on average, about $700 more per year. And 9 out of 10 women access the health care system at least once a year, compared to only 7 out of 10 men. And among the Medicare population, women do spend more of their income, 17%, as compared to only 15% for men. So there is disproportionate impacts for women in health care. The obvious question would be, why are you not addressing, let's see, we got a problem here. Why are you not addressing healthcare reform? And the answer to that is, it's anybody's guess right now with the Massachusetts equation and what happened there. Election of Scott Brown, we'll have to see and wait and see what happens. We hear almost daily reports about the mandated coverage that was to come, employer pay or play provisions, exchanges, and so forth, but seldom do we hear of healthcare disparities until, of course, the political football that was unleashed last November when the U.S. Preventive and Services Task Force issued new guidelines for mammography, and I'm sure you remember that. They recommended that on a case-by-case basis, women over the age of 50 now do regular breast cancer screening based on benefit, very sound actually, benefit cost criteria. Within days, the political fallback was extreme. A Gallup poll just days after that release, 76% of women disagreed with those guidelines. The House bill, which had already had a provision in there to change the membership of this task force that made the recommendation from 16 to 30, and the balance of those 14 people were to be specialists in women's health and health issues. The House also passed a resolution that prevented the task force guidelines from being used by insurers to deny coverage. And then on the Senate side, the Mikulski agreement also killed any attempt to make that as a condition for coverage. There's also controversy in the Senate and House on the abortion bill, or the Hyde Amendment. We won't touch that today. The Hyde Amendment is actually a rider to an appropriations bill that has to be renewed each and every year. And in 1976, when it was initially implemented, it was an outright ban on abortion. What are health care disparities? As defined by the Health Resources and Service Administration, they're just population-specific differences. And there's several ways to view these disparities. Female to male disparities, for instance. The fact that women are 4 times more likely to be diagnosed with osteoporosis and 6 times more likely to be hospitalized from that. Women in the 45 to 54 age category are twice as likely to have strokes. We can look at female to female disparities, and that will be a focus of my presentation here in just a few minutes. How women in Montana fare to women nationally, how minority women in Montana fare to minority women nationally. We can look at racial to ethnic disparities. Just last week, The CDC released a statement that American Indians are 4 times more likely to die from the H1N1 influenza than all other racial and ethnic groups combined. And of course, there's many other ways of looking at disparities based on education, urban versus rural, income, even disparities in how we could have expanded Medicaid coverage per the House and Senate bills. States with generous eligibility standards for Medicaid would have been penalized relative to those states with more stringent standards had that Medicaid eligibility been expanded. It's maybe even possible to look at disparities as to where we as aging baby boomers may end up. A study released just a couple months ago, if you become an elderly, disabled, well, we're all going to become elderly. If you become elderly and disabled and you're divorced as opposed to being widowed, your children are half as likely to devote time and financial resources towards your care. And worse yet, if you have a single biological child, he is 4 times more likely to provide care than a stepchild. So the message there is stay married and be kind to your children. What causes What causes a healthcare disparity? A disparity is really nothing more than an excess disease, an excess rate of disease which does impose a cost. As an example, in 2009, diseases which are amenable to reduced prevalence via prevention and management, diabetes, hypertension, stroke, and renal disease, were found to add $24 billion in cost to the healthcare system, with Medicare picking up 65% of that additional cost. The 10-year extra cost in those 4 diseases alone is $337 billion. Now, to put that in context, the Senate bill was supposed to trim the federal deficit by just $132 billion over 10 years. Health disparities emerge primarily due to differences in access, social circumstances, and status, and that's what we're going to look at today. As an example of access, lack of insurance delays hospitalization, and for every 2 days hospitalization is delayed, it increases hospitalization cost by 2%. Social determinants, the poor spend more on health care than the more affluent. And health status, those who report poor health have higher spending per capita, $20,000 per year for the Medicare population, with 20% mortality, as opposed to those reporting health as excellent, who only have Medicare spending of $5,000 per year with only 5% mortality. So what's different for women? Lots is different for women. Women are the catalyst for healthcare decisions for family members, and studies also show they're really the main drivers behind who buys in the household. Women are much more likely to use government social safety net programs such as community health centers, Title X clinics, Indian Health Service. The Senate bill would have added $10 billion to community health centers alone over 5 years. The House bill was more generous with $14 billion. We'll have to wait and see what happens with that legislation. And why is that important for women? Women disproportionately use these community health centers. By the way, there's 14 of them in the state of Montana, serving 25 communities. And they tend to have the bulk of their client population as low income, uninsured, and women. In areas with these centers, studies have shown that spending on health care is $1,000 less per person. And George Washington University study just recently released that spending $14 billion on community health centers and National Health Service Corps sites, these are designated federal sites to place physicians, dentists, and mental health workers, could save Medicaid $23 billion. And last but not least, community health centers, of all the controversy we've heard between the Senate and House bills, it has extreme bipartisan support. The Democrats embrace it because it empowers communities, and the Republicans accept it because it does fill a void where the private market typically does not work. In terms of where women get their insurance, 1 in 4 women obtain health insurance through their spouse, and that makes them particularly vulnerable to an interrupted insurance coverage due to divorce or widowhood. In fact, the Joint Economic Committee on Congress reports that 1.7 million women have lost health insurance as the result of job losses since December of 2007, and 3/4 of those were because of a spouse's job loss. Can current reform efforts help? Well, possibly. The House and Senate plans have subsidies for families up to 400% of the poverty level, but affordability may still be difficult. The Cato Institute, a conservative think tank, released a study that looked at the Senate version of mandates, mean-tested subsidies for the low-income folks, and the penalties that we would all pay if we didn't have insurance. And they came with the conclusion that the effective marginal tax rate, because of the way these penalties were designed, would amount to 53%. That's an effective marginal tax rate, mind you, of 53% for individuals and 62% for families. And with respect to the penalties, they found out that people earning $16,000 or more were simply better off paying the $750 penalty. They could save almost $3,000 a year. So obviously there were some complexities in the bill that would have to be worked out to provide the proper incentives for people to get insurance. Can mandates be beneficial? In Massachusetts, it's getting a lot of press attention lately. Mandated insurance did increase preventive care visits by almost 7%. 6% of women get their health insurance in the individual insurance market. And there again, the House and Senate plans both identified maternity care as an essential benefit for plans offered through the exchanges. Both plans do ban gender rating, pre-existing condition exclusions, and varying premiums based on health status. Medicaid. 1 in 10 women is covered by Medicaid, compared to only 7% for men. Women are more likely to qualify for Medicaid, however, just simply due to the lower incomes, pregnancy, men haven't yet mastered that, a parent of a dependent child, 65, or a disability. And then finally, Medicare. More than half of all Medicare beneficiaries are women, and in the 85-plus category, 70% are women in the Medicare population. And typically under Medicare, the preventive programs that are available, mammography, bone density tests, have a 20% co-insurance. The House and Senate bills both would have eliminated all cost sharing and actually increased payments for some services. Healthcare costs for women are more likely to be paid by Medicaid. That's 8% of health expenses versus only 6% for men, and have slightly higher out-of-pocket expenses. This chart tells us what predisposes women to lack of health insurance. The average rate of uninsurance, if that's a word, I'm not sure that's a word, but in the 90s you're allowed to develop your own vocabulary. The average rate of uninsurance is 18%, so you could draw a bar there down on 18%. We see the variables that do predispose women to lack of insurance being poor, relatively undereducated, young, and a single parent. The next series of slides, I'm going to whisk you through these. This is eastern Montana. We have 5 health planning regions in this state. We're in health planning region 5, and I'll show you a slide on that in just a minute. These are the uninsurance rates for women as conducted by the Consumer Population Survey, current population survey. And these are more a reflection of who doesn't have health insurance at a point in time as opposed to who doesn't have health insurance for the entire year. What's even more revealing, however, and not displayed on this graph, is that if we rank these counties by the number of healthcare workers per capita, and then look at the proportions of population that have access to the number of healthcare workers in this region, and then I'll give you a compare and contrast for Region 5 here in just a second, 52% of the population has access to only 39% of the available healthcare workforce. It's one of the least egalitarian regions we have. So I'll fast forward you to Region 5, that's this region. This region happens to be one of the more egalitarian regions in terms of how population and healthcare employment is distributed. To give you a contrast there, 65% of the population, which is, by the way, is Flathead and Missoula counties, have access to 77% of the available healthcare workforce. And again, you see the relative uninsurance rates for females by county. The bars are the margin of error, and you see a significant margin of error in those estimates as well. Females for all income classes are more likely to report problems with medical debt. And this comes from the inability to pay, whether or not they've been contacted by a collection agency for unpaid medical bills, had to change a way of life to pay medical bills, or they're paying off medical debt over time. So relative to males, women are much more, for all income classes, likely to report problems with medical debt. They're also more likely to report problems accessing medical care for all income categories. And this is the population aged 19 to 64, so this is your non-elderly population, reporting 1 of 4 problems. Didn't fill a prescription, didn't see a specialist when needed, skipped a recommended medical test, treatment, or follow-up, or had a medical problem but did not visit a doctor. The next time someone asks you how you feel, be careful how you answer. There is a very strong correlation between how you report your health and whether or not you live or die. Women are more likely to report physical limitations across all ages and races, more so than males. And not only do they report physical limitations, those disparities widen with age. And that becomes particularly problematic. I saw a quote the other day. They asked a physician, he said, well, what's really the panacea for finally getting on top of rising healthcare costs? And his answer was, how to handle an 80-year-old with chronic conditions. It's a very costly form of care. Mammograms and pap smears, preventative measures. You see how Montana women stack up relative to national benchmarks. By the way, the lowest rate was found in Utah. There's no state mandated benefit there at 70%. The highest is Delaware, 87.3% for the pap test. For the mammograms, the highest rates were found in Massachusetts. No surprise there, only 3% of the population doesn't have insurance. In Rhode Island, and again, the lowest rate was Utah. I told you we had good news. We're not bad on everything. Dual eligibles. Dual eligibles are people who are on both Medicaid and Medicare, and again, that disproportionately affects women. Medicaid covers essential services that Medicare does not, such as eyeglasses, nursing home expenses, personal care, dental, hearing services. Women are 70% of the population on Medicare and Medicaid, and 50% of the long-term care population on both. And women are also more likely to be widowed, much more so than men, and more likely to live alone. And why that's important is I'm sure you're familiar with the Class Act in both the Senate and House bills. This was the program, voluntary program, to enroll people in long-term care insurance. I say quasi-voluntary, actually. You would have been automatically enrolled. You could opt out, however, so if you chose. For the 65-plus female population, so this is the Medicare population, females fare worse on all dimensions except heart condition. IADLs, by the way, are instrumental activities of daily living. Those are 8 dimensions that cover things like the ability to use a phone, shop, prepare food, housekeeping chores, that kind of thing. ADLs on that chart are activities of daily living. That's a dimension of 17 that covers things like, do you have the ability to bathe yourself, dress yourself, groom, walk, cook, drive, manage finances, that kind of thing. I want to call your attention, however, to the number of chronic conditions. Note the higher proportion with 3 or more chronic conditions. People with 0 chronic conditions have on average 2 primary care visits a year and 2 specialist visits per year. If you jump up, and it's linear, to people with 5 or more chronic conditions, they have 12 primary care visits and over 23 specialist visits per year. And according to a December study just released a month and a half ago, the disability rate among our elderly population is on the rise after it had been declining since the 1980s, and many attribute that to obesity. Obesity, of course, has doubled over the last decade. Finally, to our measures of disparity. Recall there were 3. These are access and utilization measures. I'm looking at only 8 dimensions there. And the data is an average over 3 years, by the way. All numbers there are in percents. The no MD less than 1, it means you didn't visit the doctor simply because of cost. For pap tests and checkups, minority women in Montana fare much better than white women in Montana. That's good news. And the national averages as well. White women fared better than the national average in the percent who initiated prenatal care. So access and utilization measures. Social determinants. Someone asked the question earlier about the gender wage gap. There you are. The gender wage gap, by the way, is relative to white males in this example. So for at least some of the social determinants that have something to do with disparities, women in general are better educated in Montana than their national counterparts, but again, the position of minority women, primarily American Indians in this sample, is poor relative to their white counterparts in Montana and women in the U.S. in general. And finally, the health status dimensions. All are reported in percents on that table except the days not so good and days limited. Those are mean days per month. And the cancer mortality, that is deaths attributed to all forms of cancer per 100,000 population. And if you look at that table, on average, white women in Montana are doing at least as well as their national counterparts. The exception again, however, is minority women, again, primarily American Indians. And that speaks to the importance of the Indian Health Service. In the pending legislation, there is reauthorization of the Indian Healthcare Improvement Act, which requires reauthorization. That was first implemented in 1976. But even more importantly, the Native American community is asking for removal of payer as last resort in the Indian Health Service. The way the Indian Health Service works is you seek medical care, you bill everybody else first, and the Indian Health Service last, and they're trying to get rid of that. They're also trying to increase Indian enrollment in Medicare and Medicaid, and also exempt Native Americans from any and all penalties from not having insurance. The last thing you see there is the K6 scale. That's a psychological distress scale, for lack of better phraseology. It's on a scale of 0 to 24. If you scale higher than 13, you're stressed. I should have brought it with us and passed it out. Maybe we have a lot of 13 pluses here. It basically asks how often do you feel nervous, restless, hopeless, etc. And that's important because among the five most costly conditions in the U.S., it's heart conditions, cancer, trauma-related disorders, and asthma and mental health disorders. Out-of-pocket expenses are highest for the treatment of mental disorders. So that's particularly important. We want to watch that. So what does the health care bill do? Well, the Senate bill, which is the one I thought we might have, the one we might come closest to, establishes an office on women's health within the Department of Health and Human Services. It also was to establish a coordinating committee on women's health, a National Women's Health Information Center. It was to establish an office for women's health in the CDC, Center for Disease Control, the Health Resources and Services Administration, the Food and Drug Administration, and the Agency for Healthcare Research and Quality. However, the phraseology, the appropriation of such sums as may be necessary, there was no real hard dollars allotted to this. But reform efforts are targeting home visitation programs under maternity and child health, payment for bone density tests. Section 4302 of the Senate bill has an entire section, Understanding Health Disparities, Data Collection and Analysis. Its counterpart, the health bill, focused more on language as a barrier to health care. And statewide needs assessments are coming in the Senate bill on low birth weight infants and infant mortality. There's good support for federally qualified health centers, a form of community health centers, and also enhanced rewards for trying to locate people in medically underserved areas, which would benefit women, primarily, the higher cost users, the higher frequency users of community health centers.
We have time for one or two questions. Questions for Greg? Question. Yeah.
One of the vehicles that's been used in other states for encouraging individuals to
Give a mic,
invest.
please.
Oh, thanks. One of the vehicles that's been used for encouraging consumers to invest in long-term care insurance to reduce Medicaid use is the partnership program. Has Montana gotten any farther with that?
Anyone in the audience, can anyone address that? I do not know.
One more question. Thank you very much, Greg.
Now to talk about agriculture, I'd like to welcome a professor of agricultural economics and also an extension specialist at the MSU Department of Agricultural Economics and Economics, George Haynes. George?
Okay, thank you, Paul. Once again, I'd like to thank the Bureau for involving our department in these seminars. It's a great opportunity for us to collaborate with them. This is the second year in a row I've been given the task of bringing good news to this group. I'll try my best. Unfortunately, even though the things were pretty good last year for the ag sector, the picture is much gloomier this year. And we'll go through and talk about the pieces of that. Well, why did the ag sector do relatively well during this financial crisis? There's some pretty good reasons up there. We're going to still have substantially lower net farm income in Montana this year. We're expecting it'll be down in the 20 to 25% range probably at the end of the day. We're doing better than other states. They're expecting that net farm income in Idaho to be down in the 45-50% range. They were the people that took the hit on this dairy herd, or these dairy problems in the U.S. this past year. So even though I think we're doing better than other sectors, it's still not a very pretty picture that's out in agriculture. We came into this recession in relatively good shape because we had some very good agricultural years in the last couple. So these farmers that didn't go out and buy too much machinery to take care of their income tax problems are doing fine in terms of coming into the recession in relatively good shape. Debt-to-asset ratios in the farm sector are very good. For those of you in small business to have an average debt-to-asset ratio around 12%, $12 worth of debt for every $100 worth of assets, very good. So agriculture has benefited from that. And lastly, agricultural land values have remained relatively stable. In fact, if you look at those trends, they're relatively flat through this recession as people have been moving money from other things into relatively stable investments, and agricultural land is one of those. One other item that's not up on the screen here is that we have government programs that undergird this farm economy, and there's a lot of revenue guarantee sort of language in that. So that helps this farm sector move along without ending up with such large dips in revenue as we go through time. So all of those have been important. So what about the crop side? Just quickly in summary, lower prices this year, although we've moved back to more kind of historical means as we've moved through this year. Production looks like it's going to be a little stable to somewhat higher. We'll talk a little bit about that in a minute. The livestock sector is the one that's really in the doldrums. As you drive by these ranches out here with these cattle, they're into their third year of really not very good times in the livestock side of the house, and things don't look very good in the near term either, and we'll talk a bit about that. So in terms of cash receipts, I think this graph is going to change a little bit as we get some more numbers here in the next few days, but it looks like we're about $2.8 billion sort of industry in Montana. You'll notice that over time the crop portion of this has become a little bit more significant than the livestock piece of that. On the net farm income side of this, if you don't know this, the Cash for Clunkers program was really designed for these farmers or these ranchers so they could sell these pickups that they bought back in 1973. But in my discussions with some farm and ranch people here a couple of weeks ago, they're hoping that their pickups will last another 37 years. They're almost sure that they will. The big issue right now is lower demand. In fact, if you talk to all the ag economists, or most of them in our department, demand is the issue. This is looking at food sales home and away, and this is just year-to-year comparison. So if you look from January essentially through September of this year, this is comparing, again, year-to-year comparisons. Everything is down essentially. So what are people doing? Well, they're buying about the same quantity of food, but they're buying lower quality food. And that's a problem in a state like Montana, especially, again, to our livestock people, because we produce high-quality cattle. We like to sell into that restaurant market. Unfortunately, people are buying fewer steaks and a lot more hamburger. Don't read too much into this October number, because remember that a year ago, things were not so good in October, but there's some positive signs on the horizon, and this is the newest data that's available. Hopefully we'll have a little bit more as we move through the next couple of months of these presentations. The other part of this is on the export side, and the export side is really quite dismal. In the on the wheat export side of the house, it looks like we're going to have the lowest wheat exports we've had in the United States since 1971-72. It's about when I graduated from high school. It was a year before the Russians went into the wheat market and we had the big Russian wheat sale. So things are not good in the wheat export side of it. The beef export side is gaining a little bit of momentum, but still the beef market is way off from the BSE scare back in 2003 and really have not recovered from that. Although, as we look down the pike, they're thinking that maybe we'll see about a 10% or so increase in beef exports in the coming year. I've talked to the people that are a part of this Beef Export Federation, and they've just been over in Asia, and I said, well, how do things look? And they're saying challenging. Those markets look like they're going to open up very slowly over there, although there is some relative optimism with respect to Japan in particular, and to some degree Vietnam, but the rest of those markets look like they could be relatively difficult. So what about the major commodities in Montana? Where do we produce wheat in Montana? Our number one wheat producing county is this one. Anybody identify this? I've given you a hint. This is Choteau County. You don't drive to Choteau, Montana to go to Choteau County. You actually drive to Fort Benton. But this is the kind of the triangle area. If you look at the top 50% of the wheat production in the state, it's really up north of Great Falls. It's where most of it occurs, and a little bit throughout the rest of the state. On the crop side, winter wheat prices have gone down, and notice that you'll have some kind of brown lines or gold lines across each of these slides. These are just long-term averages, at least long-term averages going back to 1990. And you'll notice that with all of these commodities we're going to talk about, everything has moved back toward those means because we've had some pretty good years recently. It wasn't February of a couple of years ago, we had $24 spring wheat in Montana, which was a record. So we've come off some pretty good years. But again, winter wheat price is down. Winter wheat production was also down last year, even though we started off with a very good crop. We had some not very favorable harvesting conditions as we got into August and early September. Spring wheat prices were down substantially. This is really a supply response. We had a lot of wheat that came on the market. There was a lot of additional production of spring wheat, as we'll see in the next slide here, as people saw these relatively high prices and planted as much ground as they could into spring wheat. Turned out that we had up in the northeastern part of the state and in Sheridan County, huge increases in durum production up there and throughout North Dakota, and drove those prices down about $6 a bushel over that period of time. Barley prices, again, moving back toward those long-term means with production up a little bit. And again, we had a really very good production year for the spring crops as they harvested just a little bit later and weren't damaged by as much by some of that kind of wet weather that we had. So what's the future look like? Well, the best place to go look for information about agricultural prices is to look on the futures exchanges. We actually look on the Minneapolis Grain Exchange for wheat, Chicago Board of Trade for corn. These prices are not going to make people very happy in Montana. We used to think that $4 wheat was a good thing, and if it got up to $5, things were very good. These prices are giving most farmers a sad face these days. They're not very optimistic about what these markets look like. You notice that the spring wheat markets are up a little. Oftentimes there's a much more of a price differential in spring wheat and winter wheat. Those are about as narrow a differentials as I've seen in some time. The story, and we'll talk about this in a little detail here in just a minute with corn, we still have to watch corn in the Montana market because corn ends up having a couple important impacts for us, and we'll talk about that here in just a sec. On the global side with the wheat market, one thing that's really critically important to understand with wheat production is that there's countries here look at China. As you go across, they're 17% of the market. India is now 12% of the market, and everybody's saying, well, what is FSU? That's former Soviet Union countries. There are 12 of them. They're now almost 16% of the market. Those are people we used to export a lot of wheat out to. They now comprise about 45% of the market, and there really are competition in the market out there for wheat sales right now. They're much more willing to go into the market and negotiate for price than the U.S. producers have been. So we're running into some price competition from these people, especially a lot of additional wheat has come on the market from the former Soviet Union countries. So what do I think is going to happen in 2010? Well, I'm not going to go out on too much of a limb here, but winter wheat plantings are way down. In fact, they're 22% down. This will be the lowest winter wheat production, I think, in Montana probably in some time. And on top of that, this wheat crop's not in very good shape. We haven't had enough snow out there to cover it, so it's one of the lowest quality winter wheat crops that we've had in a while. So what do I think about production? Well, it's a little hard to tell as we look across all grains because the spring grains are not in yet, although I'm thinking that we're thinking those planting intentions will be down just a little bit. So what's that going to do to wheat prices? Well, you can look at those futures prices we looked at just a minute ago. Not very optimistic on the wheat price side of it either. Looks like they're going to be in that $5 range. So we can make these two arguments below the line there. What's going to happen to wheat prices? Wheat prices always soften after the first of the year, so we can make that every single year that we do these presentations. What's going to happen later in the year? It will turn out that there should be a little bit more strength in those markets, but we're not expecting them to gain a lot of strength over that period of time. The big issue is what's going to happen to this financial markets. What's going to happen? Are we going to see these economies grow or not? Demand is what's on everybody's mind. One crop I don't talk about much in Montana, but it allows me a segue into livestock. We still worry about corn here. We're growing more and more corn in some places in Montana, especially down in the Yellowstone Valley, as people are trying to switch from sugar beets into other things. Unfortunately, they're tied into contracts that really don't allow them to do very much of that. But we're seeing more corn produced. Corn prices matter to us. We originally thought that things didn't look very good with corn in the Midwest. There was a lot of acreage planted in corn. In fact, this should be our second largest and maybe our largest corn crop ever. So there's ample supplies. Exports in the corn market are weak. Had cool summer temperatures, so that helped us have relatively good corn crop. The only problem is that around Omaha, Nebraska right now, there's corn that's still in the field. These guys can't harvest it because the moisture contents are too high. So we have this little bump in corn prices because we're not sure what's going to happen with that harvest. Oil prices are relatively weak, so again, that puts a little bit of downward pressure on ethanol, although if you look at ethanol futures as of yesterday, they started to gain some steam. Not necessarily good news for us in Montana because of the bottom line here. If we can drive these corn prices down, that's good news to producers, but we're seeing a little bit of bump up in those corn prices now. That only means that we're going to have lower prices for our calf producers here as we approach next fall. So corn critically important, even though we don't raise much of it. Okay, what about the livestock sector? Well, our livestock sector in Montana, the number one county here is Yellowstone. Why Yellowstone? That's where it's about the only place in Montana we do much feeding. If you expand that out to livestock production for the top 50% of the counties in Montana, you notice the kind of north central as well as kind of the other two counties that follow Yellowstone are Beaverhead and then Madison down in the southwestern part of the state. So what's happened in this cattle market? These calf prices have been relatively low. In fact, these long-term average prices in the livestock sector have been relatively low. You'll notice that calf prices actually moved below the line a year ago, and I'll be very surprised if they move up above the line this year. The forecasts are not very good in the cattle market. But you say, man, there's a lot of calves that came on the market last year in Montana. You're right. Look at this upward sloping line here, really starting back in 2005. That's actually a bad sign in the livestock business because this means that people are marketing their heifer calves. And if you market your heifer calves, you can't build your cattle herds. So we're in a situation right now where I think we're 2.5 years or thereabouts out before we can see any significant cattle herd buildup in Montana as well as in other states. Which is good news on one hand if the markets would turn and we have better financial conditions here in the United States here and demand increases. There's some reason to believe that prices in the livestock market could move relatively quickly for these beef producers as demand increases. Cattle inventories have remained relatively stable. This is for Montana, but national cattle inventories look about the same. Nothing really changed there. What do I think is going to happen to prices? Again, I just go back to the futures market, and again, look at the bottom line here. The top line doesn't really make any difference to us. Live cattle includes a little bit too large a group of cattle for us to worry about much, but feeder cattle give us a hint about where our calves will sell in the state. And we get a little bit of a positive basis. We get a little bit of prices a little bit higher than this, but right around $1 a pound is what these are relatively low cattle prices. And again, our cattle producers don't have a smile on their face these days. Things are not looking very good for them. even though they're moving back toward, possibly towards some long-term average prices. So what do we think in this cattle market? Well, the domestic market still, especially in the restaurant beef trade, doesn't look very good, and we in Montana raise relatively high quality cattle, and we also raise relatively high quality grains. So as people are switching out of quality and going for quantity, that's a concern across the entire agricultural sector here in the state. International demand, we're very concerned about that. As I suggested on the grain side of the house, we're looking at it being historical lows or nearly historical lows going back into the early 1970s. In the cattle side, we think maybe we'll have a 10% or so increase, but remember that we're moving from a relatively low basis for that 10% increase. And we're really looking at the increase coming from Asia, and that being offset by actually declines that we think are going to happen in Mexico and Canada. So we'll have to see where that all washes by the time we're at the end of the year. And of course, the one piece that's out there yet is ethanol and this link between energy and corn. And as of yesterday, about noon, I would have said, hey, I think we're going to see these corn prices continue to ratchet downward. About 2 o'clock yesterday afternoon, or after reading some of the new ethanol data that's out there, I've kind of changed my tune just a bit. I think that we're looking maybe at some upward movement in those corn prices as this ethanol market looks like it might have some strength that I didn't think was there earlier. So with that, I have time to take a question or two.
For George. Question back there.
Yes.
There's a mic back there.
The commodity aspect of Montana agriculture? Is there any tracking or discussions involving what I'd consider the higher value crops, such as vegetables and poultry, eggs, dairy, that the local movements are trying to encourage? Is there any tracking, any trending to seeing what kind of economics that involves?
If you want to look at emphasis for my job over the next few years based on a meeting I was at just a few days ago down in California, there's a lot of interest in us doing a lot more in the vegetable and the local production markets. We don't have any statistics, or I don't have any statistics in this presentation about that. We think it's our inkling that those markets are certainly gaining some strength and getting to be much more important. How much of the total production of Montana agriculture is attributed to those crops? Relatively small yet at this point in time, but relatively high valued. They have certain markets that they fit into very well. But again, is when I talk about them being relatively high value markets, they're also relatively high income markets. They appeal to people that have, that have relatively high income. So this is where we're going to be putting more attention, and it's really becoming an important segment of the market for us to understand a lot more about. So,
tracking the cost of Are you tracking the cost of production relative to the value of the crops and the beef?
Yeah, absolutely. On the producer cost index moving from 2008 to 2009 in Montana only went down by 1 percentage point on the crop side. And you think, well, how could that happen? Because I heard about all these much lower fertilizer prices and much lower fuel prices. Problem is that people enter into long-term contracts. And that happened especially on the fertilizer side. I mean, you could buy fertilizer for 50% if you'd have waited and bought it last year when you planted in the spring rather than entering into a contract in the fall. So that's kind of what's happened there. On the livestock side, about the same amount. We've had relatively low prices in the livestock side. The production costs have remained relatively stable over that period of time because we came off of a year last year with relatively high hay prices. So those haven't moved very much. Yep.
So I just speak about
Thank you for your presentation. One of the things that you had listed in the Outlook publication, which is on page 26, and the third paragraph, which was very interesting, but unfortunately not mentioned on your presentation, was about cattle imports, and then particularly imports from Australia increasing to 46% August 2009, and your report basically saying that the cattle production going down around the 10% figure. And I just wanted to know, from a question perspective, are there any trends in terms of what tariffs will be implemented between Australia and the U.S.? Because it seems quite disproportionate where you're having an increase of such a high number of 46% of Australian beef coming in, and the general beef industry continually going down around double digits. And when you think about it, perhaps there should be Montana outback more in Australia versus more outbacks coming here.
Well, my guess is that there's not very much of that meat that's coming from Australia that's going to Outback. It's actually going to the hamburger market. They had some relatively some drought conditions in Australia that causes some liquidations of cow herds. So we saw more Australian beef coming over here. That has certainly subsided by now. I'm not anticipating any tariffs on beef coming in from Australia, but that was a big increase in the percentage of beef that in the export trade that was coming from Australia. So, but
One more question.
yeah.
Could you comment on ag land values in Montana and the nation?
Well, you know, we don't, excuse me. Can I comment on ag land values in Montana and across the nation? Ag land values have remained relatively stable. We don't have any numbers that I've looked at specifically for Montana in the last about 6 months or so. But if you look at the trends that I saw in some economic reports about a week ago, it looks like they've been trending nearly a horizontal sort of trend with a little bit of a downturn in them, but they've been very strong. And you look in the Midwest, in particular in some irrigated agriculture, there's been some substantial increases in land prices even through this recession. So it's been one of the high points of the ag sector to have relatively stable land prices through some relatively difficult times.
Thank you very much, George.